Next under orders, we have radiology. This again pulls up a default radiology menu. Similarly to the diet menu, this is an overlying order menu that has a larger radiology order menu with more options sort of in the background. So I'll show you that as an example. Obviously, we would just select which radiology department we want. Radiography means general X-ray. So we have a number of different X-ray orders. We can scroll down and down. As I mentioned, with diet orders, if you sort of find the end of the list in this order menu, here, obviously you can look through, there are a number of different options which could be very useful, but if you want to look for something else, at the end of this list, you can select this other radiography exams. This pulls up the main radiology ordering menu. So again, rather than the order menu option that we had a second ago, we can choose the department in the drop down, and then we have general radiology. Again, I've saved a quick order here, which we can show you again in a minute. It's exactly the same as it was for medications and labs, but we can choose from even more X-ray options potentially than the ones that appeared in our order menu. So let's say we want a scapula X-ray of the left, reason for study, throwing injury, no, struck by object. So we would put in our clinical history here, 99-year-old woman, history of XYZ, struck with an object. And we want to evaluate for scapula fracture. So you select our date desired, let's say it's stats because we're concerned about a fracture. We choose if we want ambulatory, meaning the patient walks to radiology, portable, meaning for inpatients, the portable X-ray comes to the patient's room, stretcher for a patient that cannot get out of bed, or a wheelchair for a patient that can get out of bed. Let's say we want to stretcher this person to radiology. We should make sure that we're selecting the correct location for our patient. We're going to assume this is an inpatient, and then we can just select main radiology here. Sometimes it's relevant to state whether the patient is pregnant or not, and whether they're on isolation or not. And then we would select accept, and the order would go in. Or if we wanted to create a quick order, again, we come to options before accepting. Once all our settings are in place, how we like them, say save as quick order. We enter the title. And we can enter a title and select OK. We'll cancel in this case and say quit. And we'll say no, so we don't accept this. But as an example, come back into this menu and we'll say general radiology, AM portable chest X-ray, which is my quick order. So you can see that it's set up as chest portable, bilateral exam, entered for this date, which we would need to adjust to make sure that it's getting done on the correct date. We still need to enter our patient information, which is relevant to our specific patient. We can select an urgency if we want. It's defaulted to portable and inpatient, and then we could accept. We'll quit for this example.